uncover the gripping true story behind the ghost map, a medical detective tale that reshaped the future of cities and saved millions of lives. Dive into the 1854 cholera outbreak in London, meet the unlikely heroes who defied conventional wisdom, and learn how one hand-drawn map changed everything. London, 1854. The city was choking in its own filth, sewage spilled into the streets, and death crept silently through every neighborhood. One morning in the crowded slums of Soho, a mysterious and horrifying disease began killing people by the dozens. No one knew why. Was it the air? Was it a curse? Even the most respected doctors were helpless. Panic spread like wildfire, and in the chaos, bodies piled up faster than answers. Entire families vanished within hours, and fear gripped every corner of the city. But in the midst of this terror, a quiet man named Dr. John Snow refused to accept the mystery. Armed only with a pencil, a map, and relentless determination, he began walking door to door, tracking every case of cholera with near obsessive precision. He didn't have today's labs or computers, just grit and logic. What he discovered would not only pinpoint the true cause of the outbreak, but also challenge centuries of medical belief and revolutionize our understanding of disease itself. This is the full story of the Ghost Map, a gripping tale of death, discovery, and how a single map changed the course of science, public health, and urban survival forever. And it all began with one contaminated pump. The summer of 1854 was unusually hot in London, and the stench of waste was unbearable. People lived crammed together in narrow streets with no proper sewage, their water drawn from contaminated wells. In the heart of Soho, the outbreak began like a whisper, just a few deaths here and there. But within days, the numbers exploded. Entire households were struck down in hours. What began as stomach cramps turned to relentless vomiting and diarrhea, leaving victims dead within a day. No one understood what was happening. Some believed it was divine punishment. Others thought it was miasma, bad air floating in the city's foul atmosphere. Newspapers printed rumors. Citizens wore scented handkerchiefs over their faces, hoping to ward off the invisible killer. Local authorities, paralyzed by confusion and fear, buried the dead quickly but failed to stop the contagion. The Broad Street area was hit hardest. Mothers clutched dying children. Neighbors disappeared overnight. The disease showed no mercy, rich or poor, young or old. And yet, despite the chaos, no one was truly investigating why. All anyone knew was that the deaths were spreading outward from one small area, like a ripple in dirty water. And that's exactly where Dr. Snow would begin. Dr. John Snow wasn't the kind of man to follow the crowd. A respected anesthetist with a mind wired for logic, he had long doubted the prevailing belief in miasma, the idea that diseases spread through poisonous air. He believed the real culprit was water, contaminated with something invisible to the naked eye. It was a theory that most experts dismissed as nonsense. But Snow had seen patterns others ignored. He believed data could reveal the truth if only someone was willing to look closely enough. As the cholera outbreak ravaged Soho, Snow saw an opportunity to test his theory. Instead of waiting for answers from the medical establishment, he grabbed his notebook and hit the streets. He interviewed families of the dead, marked addresses, and tracked every case like a detective solving a brutal crime. His instincts told him the answer lay not in the air, but in the water people drank. The more he mapped, the clearer the pattern became. The deaths were clustering around a single water pump on Broad Street. Snow now faced a dilemma. He had the beginnings of proof, but would anyone listen? In a city gripped by panic and superstition, facts alone might not be enough. Jon Snow's investigation reached its tipping point when he transformed data into something no one could ignore: a map. With meticulous care, he plotted each cholera death in Soho, using small black bars to represent fatalities at every address. The visual was haunting. A dense cluster of black marks radiated outward from one central point, the water pump on Broad Street. This was more than just a theory. It was evidence, plain and powerful. The map didn't rely on medical jargon or complex arguments. It spoke in stark, undeniable clarity. Anyone who looked could see the truth. The closer people lived to the pump, the more likely they were to die. Snow presented his findings to local authorities, urging them to disable the pump immediately. There was resistance. How could something as innocent as drinking water be the cause? But with no better explanation and mounting deaths, they finally agreed. The pump handle was removed. What followed was astonishing. The outbreak began to subside. Snow had done what no one else had, used science, logic, and simple observation to solve a deadly mystery. But one piece of the puzzle remained. How had the water become contaminated in the first place? That's where Reverend Henry Whitehead entered the story. Reverend Henry Whitehead was everything Jon Snow wasn't. Charismatic, deeply religious, and trusted by the people of Soho. At first, he rejected Snow's theory. He believed in the traditional view that cholera was spread through foul air, and he thought Snow's ideas were, at best, speculative. But Whitehead wasn't just a preacher, he was a man of the people. He knew the community intimately, and that made him the perfect ally, even if he didn't realize it yet. Driven by his own desire to help, Whitehead began investigating the outbreak from a human angle, talking to families, listening to stories, and tracing the lives of the victims. Slowly, his findings began to align with Snow's. The turning point came when Whitehead discovered the true origin of the outbreak: a single cesspit that had leaked into the Broad Street pump's water supply. The cesspit belonged to a house where a baby had died of cholera just days before the outbreak. The child's waste had contaminated the water, seeding death across the neighborhood. That single connection sealed the case. Whitehead publicly admitted Snow was right. Their unlikely partnership not only cracked the mystery, it helped convince the world to rethink how disease spreads. The removal of the Broad Street pump handle marked more than the end of a deadly outbreak. It was the beginning of a revolution. Jon Snow and Henry Whitehead's investigation laid the groundwork for modern epidemiology and transformed the way cities handle disease. Their work challenged centuries of dogma and proved that science, even without modern tools, could uncover life-saving truths through observation and logic. In the years that followed, London began to overhaul its sewage system. Public health reforms spread across Europe and beyond. The idea that clean water and sanitation could prevent disease became a cornerstone of urban planning. Millions of lives were saved, not just in that moment, but for generations to come. The Ghost Map isn't just a story about cholera. It's about how courage, curiosity, and data can conquer even the deadliest mysteries. It's a reminder that even in the darkest moments, truth has a way of breaking through. If you found this story as fascinating as we did, make sure to like, subscribe, and hit the bell icon so you don't miss more incredible stories that change the world.